If at any point you feel any symptoms of illness, it is very important you report this to your supervisor or employer right away, or to a healthcare clinic. We are going to review how to do this in our next video. It is very important to report right away, and while you wait for further direction, stay away from other people, so in the case that you are sick with COVID-19, you do not pass this on to others. Talk to your coworkers about the importance of having them report if they have any symptoms as well. As we will review, if you do become sick, there are supports to help you recover, and financial supports if you are sick and not working as well. Let's review key COVID-19 safety practices that both control the spread of the virus and help protect from it. First, it is very important to physically distance, to keep a distance of 2 meters from others as much as possible, to reduce the chance of spreading the virus among people. It is very important to wash your hands frequently with soap and water for at least 20 seconds. This will kill the virus that could be on your hands and therefore help avoid its spread. You can also use an alcohol-based hand sanitizer of at least 60% alcohol. Avoid touching your eyes, nose, or mouth, as your hands could be contaminated with the virus, and your eyes, nose, and mouth are key entryways the virus can enter your body. Again, wash or disinfect your hands frequently. If you need to cough or sneeze, do so into your elbow or into a tissue, not into your hands. Do not reuse tissues and throw them out immediately, and wash your hands. If you notice you are sneezing or coughing frequently, report these symptoms. Connected to physically distancing, avoid close contact with others, such as shaking hands to greet. At the workplace and in housing, safety measures focused on controlling the spread of the virus and protecting against it should prioritize starting with the most effective measures. In terms of COVID-19, this includes first trying to control the potential source of the virus to eliminate the risk for others. For COVID-19 at the workplace or housing, this includes limiting the number of workers in a space, having workers spaced out and physically distanced. This is done so that individuals are far enough away from each other so that if someone had the virus, it would not spread between people. From there, if workers are required to share space and be closer to one another, then safety measures should be put in place, like putting up barriers or ventilating the air, to try to eliminate the chances of the virus traveling from one person to another when people are closer in distance to each other. Wearing surgical or cloth masks are less effective than barriers and ventilation, but are also meant to help reduce the chances of droplets from one person that may have the virus traveling into the air or onto surfaces, increasing the chances of infection for others. So again, these measures are meant to try to reduce the travel of the virus. The last level of protection includes measures that focus on protecting the individual from the virus at the point where the virus may be present close to them. This includes having people wear personal protective equipment, such as respirators or face shields or gloves. As we will discuss further, surgical masks or cloth masks do not significantly protect the user from breathing in the virus, but again are meant to prevent the travel of the virus into the air or onto surfaces. The main message here is that at your workplace and farm housing, COVID-19 safety and protective measures should prioritize those that are the best and most effective. As we mentioned, it is very important to physically distance, to keep a distance of 2 meters from each other as much as possible. If you encounter a work activity or a situation in your bunkhouse that does not seem to allow you to physically distance from coworkers, bring this up to your supervisor or employer to address your safety concern. If physically distancing is not possible, other levels of safety measures should be considered and applied. Physically distancing should be maintained as much as possible during transportation, both in terms of transport to different work locations, as well as any transport off the farm into towns or public spaces. During transportation, you should wear a face mask to reduce the transfer of your droplets, and you should make sure to follow safety practices such as not touching your eyes, nose, or mouth, avoiding high-touch surfaces, and washing or disinfecting your hands frequently. Ventilate spaces, rooms, and closed areas so that fresh air enters. You do not want the accumulation of exhaled air in these spaces. In the case of an infection, the virus may be present in the exhaled air of a sick person. Keep windows and doors open as much as possible. If possible, use your own tools assigned to each person or the same few people. This way, many people are not touching the same tools, risking the transfer of the virus through hands and tools. Regardless, disinfect tools before and after use to get rid of the virus if it was on the tools. Make sure to disinfect frequently touched equipment, like steering wheels of vehicles or handles of mowers or trolleys. This way, again, you can get rid of the virus if it was present on these surfaces. Employers should provide cleaning and disinfecting solutions and materials. Make sure to disinfect and clean any work and housing surfaces that people touch or that may have come in contact with any droplets from people. Your workplace should put in practice a regular cleaning schedule. The same idea here. Make sure to disinfect frequently touched items such as doorknobs, light switches, and other objects and surfaces in the workplace and in housing that many people could be touching. Your employer may recommend or ask you to wear gloves at work. This will reduce the risk of having your hands come in contact with surfaces that could be contaminated with the virus. However, even with gloves, avoid touching your face, eyes, nose, or mouth. We will talk more about safe glove use in the following section. Make sure you wash your clothes frequently to reduce the chances of the virus staying on clothing and spreading. Also wash and disinfect your shoes or work boots regularly. If possible, consider leaving your work shoes outside and not wearing them inside your house to avoid the risk of bringing the virus from high foot traffic floors at work to your housing spaces. Make sure to clean and disinfect laundry machines, especially on the surfaces that people touch. In general, safety measures that should be taken to reduce the risk of virus transmission at work and in housing include organizing fewer workers in a space to allow for physical distancing, staggering work locations, breaks, and meal times as to also allow for space and distancing. Consider keeping work teams small and having these teams live, work, and eat together, avoiding contact with other workers as much as possible. Organizing as much time outside as possible in open air or in large spaces. In indoor spaces that are shared, increase ventilation to bring in fresh air or add air cleaning. In situations where workers are working close to each other, put up physical barriers to stop the possible travel of the virus. Review what personal protective equipment is needed and provide training to its use and disposal. Discussion on safety concerns and ideas should be promoted and supported at the workplace and include workers, supervisors, and employers. This video was produced by staff from the Occupational Health Clinics for Ontario Workers, or OCHO.